I'm with Holly Bingham, and she's a GAPS practitioner, and I'm excited to get to know her more. How did you find the GAPS diet?
Yeah, so I was actually an emergency room nurse for about 10 years first. And then I had my first daughter, and this is about 7 years, almost 7 years ago. And she was actually really sick. She was in the neonatal intensive care unit for a few weeks. And I wound up after we got her home, it was just a really stressful situation with her gone and with me postpartum. And I wound up starting to develop a whole bunch of different symptoms that I had never had before. And I actually thought they were crazy. I thought they were so outlandish. I had no idea what was going on with me. Now that I work with patients all the time with GAPS, I'm like, oh, these are normal GAPS symptoms. Like, this is something I see all the time. But it was really scary to me. So I wound up, having all these different symptoms, not knowing what to do with them, talking with some of my colleagues in the emergency department, and they said that I probably either had MS or a brain tumor or something like that they were really concerned about, and wanted me to start on some drug trials and go down testing and stuff like that. And I was just like, what in the world? This is not like, this is crazy to me. I just had a baby. How in the world do I suddenly have a brain tumor? And it didn't make sense. So I was kind of grasping at straws, trying to look into some maybe, alternative things, or just kind of looking like, what can I control myself? What can I do? And a friend of mine told me about an anti-candida diet she was doing for her daughter who had cradle cap. I was like, well, I don't have a cradle cap, but I'll try it. Let me look into it. So I did a anti-candida diet, which helped dramatically. And then once I did that, and I was like, oh my goodness, like nutrition, I have to focus on nutrition. But when I started putting new things into my diet, I started having symptoms come back. So that's when I was like, okay, there's a deeper level I have to find. And so another friend of mine, actually a colleague of mine now, told me about GAPS. So I wound up looking into GAPS, using the GAPS protocol, finding that health that I was looking for. That's how I came to GAPS. So kind of a friend and just people, God bringing the people into my life who needed to be there. So, yeah.
Well, that's cool. So you felt directed really to, or the people were directed, or somehow you interact in their life. So it's interesting. What kind of symptoms were you having?
Yeah.
Or your baby was having?
Right. So my baby actually, it seemed unrelated, but now I'm finding that everything is related, right? So my baby had aspirated meconium as she was coming out, and so she was intubated. She was on life support, and there's a lot of conflicting information about meconium and what leads to it, stressors that lead to it, that kind of thing. So I do think that probably some of the stress that I was going through at the time factored into that, and then factored into my own symptoms. But what I was experiencing, I first started not being able to sleep. That was the first thing. So I would just be up 24/7 for maybe 4 or 5 days at a time, not sleeping at all. And then I started losing the feeling in my hands and my muscle, like any kind of power in my hands. I lift something up and then it would just drop. I couldn't feel things. So there's like paresthesias. And then I started not having vision. So all of a sudden it would just kind of go that tunnel vision, almost like before you pass out, if you've ever experienced that, like tunnel vision, everything's closing. And I would lose that just very suddenly. It seemed random. So I'd be driving and then it would suddenly go, all my vision would be gone. And several times I was on the highway, I had to pull over really fast, get off. And then that would last for several hours at a time. I got migraines, and I started hallucinating. So I was having both auditory and visual hallucinations where I was seeing really traumatic events just play before me visually, and then hearing just these intrusive thoughts constantly with voices. And all of this I had never experienced anything like this before. I always was really healthy and strong and athletic, and I never had anything like this before. So it was really terrifying. But like I said, things that I experience all the time now as a practitioner working with people. So I'm actually really thankful for the symptoms that I've had. And thankfully, my symptoms were actually very short-lived. So after I had them for about 3 months, pretty consistently for about 3 months. And then after changing my diet, it was only about 2 weeks later that my symptoms pretty much resolved. And then kind of came back again when I went back on foods, and then really resolved again with GAPS. But it was pretty quick. So I'm really thankful that that's my story. But I am also, like I said, just thankful that I can relate with other people who are having similar, really scary, sudden symptoms. So
Yeah, that's really sudden. I mean, you have a baby and all of a sudden your life is turned upside down.
right.
Not what
Yeah.
you expect. I mean, you didn't do anything weird. You just had a baby. And
and I also had a
unusual
natural birth. I mean, it was all natural. I went to a birth center. I had a midwife. I had no medication. I mean, I was doing everything that I thought was right. And still it happens, sometimes you don't know all of the other things that are hidden for a time that kind of come up with some big event of stress. So
yeah, stress makes a major part.
Mhm.
Before we go on, there's a little bit of feedback. So you came to the GAPS diet because of the birth of your baby, and so you found lots of symptom removal, and that is just really awesome. That food can be such a miracle pill, so to speak.
Yeah, absolutely.
So it kind of answered my next question, because how'd you become even involved with GAPS? And it was because of your baby. Is there anything more you want to expound on?
Well, yeah, I mean, I think that's pretty much my story. That's how I came to find GAPS. I still, it took me a little while to become a GAPS practitioner. After that, I actually went to school. Again, I was a nurse. I was working in the emergency department. So I went back to school to become a functional nutritional therapy practitioner, and did that for a few years. And then a colleague of mine was like, "You really need to be a GAPS practitioner. Why are you not a GAPS practitioner yet?" So, and I was pregnant with my second at the time. So I wound up actually 4 days after he was born, starting the GAPS practitioner program. So it was a little bit of a trickle of me actually getting in there and kind of, practicing the different ways. But yeah, that's my progression of how I got into being a practitioner.
Well, that's how you got into be involved with GAPS. That's pretty brave to actually start the program when your baby's so little.
Yeah.
Why did you decide to do that when he's so young? You just gave birth.
I really wanted to make a transition from the hospital. I was, like I said, working in emergency departments. I already had one baby. I was having my second. I have 3 now, but I just really knew I did not want to, 2 things. I didn't want to continue the kind of the schedule of it and the 14 hours at a time in emergency departments, seeing a lot of big trauma and crisis and working with people in a way that I didn't feel like we were providing the best support for them. And so, we were giving medications for people coming in with psychiatric issues. It was just all medication. And then they get their tray and it was soda and different, like a fruit snack was the healthy part of it. And I just, with learning everything that I had, both for myself, and then when I went back to school to be a functional nutritional therapy practitioner, I was like, this just does not sit right with me. I don't feel like I can continue to do this. So I knew I wanted to make some kind of change, both for my family, so that I was not gone for 14 hours at a time, numerous days a week. And then also just so that I could really practice in a way that I felt was serving my patients, rather than putting a Band-Aid on the situation and then kind of moving them along.
Yeah, sounds like you wanted to help them in a more long-term or deeper way than what you're doing before.
Right, which is just impossible in the emergency department. It's not necessarily to a fault of the ER. It's there for a reason, right? There's a lot of good that we did there, and we resuscitated many people and saved lives from car accidents. And there was a lot of good that was done there. But at the same time, for the chronic things that I knew I wanted to really help more with. It just, that wasn't the place anymore. So my time there was coming to an end. So that's why I kind of made the shift.
Yeah, and that happens with all of us. Okay, it's still it's doing the same. It's not really
Okay.
that bad. So if you want to switch to the other headphones, whatever's
Okay.
comfortable.
Okay.
I'm sorry to interrupt this
No, that's totally
the
fine.
whole
I'm sorry.
time.
This is not, we're, let's see, hold on.
It's okay. I mean, I'm in the garage with like 6 flies. So
Okay. And I think actually my computer cord fell out of the wall. Hold on one second.
okay. Okay.
Okay. Do you think,
All
is
right.
this usable or do you want to reschedule?
I think it's still usable.
Okay.
Yeah. I mean, am I echoing on your end at all? Am I
No, you're
clear?
clear.
Okay. I mean, there's just a little bit of an echo. What do you think? You think it'll be okay, or
I can't hear my echo. So if
you can't hear?
yeah. So, I mean, whatever you want. If this is not, I want you to have good content. So if this is not
Yeah.
good and usable, then I don't want you to, I mean, I'm happy to, to finish, but it's up to you. If you listen to it and you're like, that was awful, we can absolutely do it again. So I'm happy to do that. So
Okay.
this can be a practice.
Okay. Yeah. Well, maybe we go ahead and finish, and then we can decide after, or you can decide if maybe you want to do it again. I know it's like 11 now. We were just scheduling 30 minutes. All this difficult.
Yeah.
Do you still have
Oh, that's
time,
okay.
or?
I do. I have time to go on. Yep. My next thing is at 2:00. So I have time. We're good. Or 2:00 my time. So I have an hour in between. So all I was going to do is going to have some lunch. So that's fine.
Okay. All right. Then we'll just go ahead and go. And then if you want to redo it, then we can redo it.
Okay.
If you think when you hear it on your end, and
Okay.
I'm going to meet with my coach this week. I'll see what he thinks too. So, I mean,
yeah, that sounds good. And really, this is for you. So let's finish. And then when you listen to it and you and your coach, if you want to redo, I'm happy to do
you're
that.
happy to do that. Okay.
Yeah. Yep.
All right. then we'll just go on. Okay. So my next question is, and you've touched on it a lot already, is why do you believe in the GAPS diet?
Yeah. So for a couple of reasons. So first of all, because I love anecdotal evidence, right? I love hearing stories of things that work and trying them and see if they work. And that's what happened for me. So as far as with my story, with friends, with patients that I've seen, I've seen really beautiful success with GAPS. So that's one reason. Another reason is that it's just real, traditional, properly prepared food, right? It's not anything that is obscure or unusual, maybe today in today's practice, but as far as how food goes, it's just real food. We're not using powders. We're not using supplements for the most part. It's very just basic food. And actually, this is how my dad's from Poland, and he grew up on these foods. I recently asked him, because I love learning about like traditional remedies, right? Like home remedies for things. And so I asked him, Dad, what did Babcia, my grandma, what did she give you when you were sick? And he's like, we didn't get sick. Like, what? He's like, we didn't get sick. We never hear that now, I mean, everybody has eczema or allergies or asthma or something going on from when they're kids, but they didn't. They just ate stock and ferments all the time, and they were fine, So that's another thing about GAPS. It's not something that is new. That it's not tested by time, like it is. It's old, it's time proven, and there's so many stories that go along with it. And then another thing would be that it goes along with my philosophy of healing, is that our bodies were created to be able to heal when we are supplying them with what they need. And that's what GAPS uses, right? We're just supplying our bodies, we're replacing deficiencies, we're looking at the body and seeing oh, maybe more vitamin C, looking at symptoms and what is the body asking us to do, and really using that intuition, that God-given intuition, and how our bodies were created to be able to heal while using GAPS. So again, it's not like putting a whole bunch of new man-made things in the mix. It's just really helping to supply our bodies with what we need. So, and I feel like it's a win-win.
Yeah, so you like it because it's using food that we all eat, we just are eating it a little differently. Was your dad, I guess he didn't feel like you were doing something really weird then, it sounds like.
Right. And actually, I talk with him because he doesn't eat this way anymore now that he came to the States. And so anytime I talk with him or he comes to visit and he's eating food, he's like, oh, this is what we used to have. Like, it's very reminiscent for him. It's not weird. It's just, it's kind of a throwback. Oh yeah, I remember this. This is what we did. So, yeah.
Well, that's kind of fun. That's really fun. Where do you think the best place to start for someone on the GAPS diet?
So I do a lot of baby GAPS. I wrote the baby GAPS course. I do a lot of baby GAPS in my practice. So if we could go all the way back and say everyone would start as a baby with their first foods after formula or breast milk, starting with GAPS as a baby, that's where they should start. But with and before that, their moms when they were pregnant, and then before that, even before they conceived, like how far back can we go?
Right.
But at the same time, kind of a lot of people ask me this on do we start with intro or full GAPS? Is that kind of what you're meaning there, or
just any way you see it, or any way that you help people start?
Yeah. So I've seen, just the more that I'm practicing, I'm seeing that people need to start on full GAPS unless there's a really big kind of crisis point that needs to get them into intro. I like to start on full because it's so much more than just the food, right? It's so much about your lifestyle, about your exposures, what you're putting on your body, putting on your skin. And so usually when I work with people, I first work through, let's look at your home, your environment, your products, your cookware, all of the things. And I think when you start with intro, it's so easy to focus just on the food, the stock, the ferments, the BKFAS, right? Make all of the food so much that it often actually gets missed, that we need to start with the other things that are affecting the body as well. So usually when I work with an adult or a kid older than a baby GAPS age kind of child, we'll start with full GAPS and kind of like practicing GAPS with doing really like looking at lifestyle first, surroundings, environment, and just introducing a few, getting some BKFAS in, getting in a little stock, even if it's a drop of stock or a teaspoon or a thimble of stock, and just starting really slow and looking at the life as a whole, and then working into full GAPS, and then working into intro as needed. But I do like to take it gradual. I've definitely seen some people I've worked with that we've, after kind of doing some intro, because it seemed like, hey, now is the time, let's just get right in, let's do intro, let's go heavy hitting, and let's do it, that we found a need to, you know what, let's hold on a second, let's go back and let's start really from the foundation, and just start slower and make sure that you know where you're going, and then jump in after. So that's usually where I start.
Okay, you start getting them used to GAPS, but also starting to change what they're doing in life, what they're using in their kitchen and in the bathroom. And
sometimes that takes a long time, I mean, sometimes whether it's budget or mindset or whatever it is, sometimes it takes a really long time to actually start replacing what you have in your home, or even just the stressors in your life. I mean, sometimes you can't actually remove stressors from your life, right? If it's a family stressor, or you're in a home with mold or something like that. So I find that addressing those while just putting in some of the GAPS foods and just working to very slowly transition And that might be a month process, or that might be 6 months, or that might be 2 weeks. It really depends on the person, but that's where I would start and then advance from there.
It seems like that helps them get further in GAPS, but also reduces their overwhelm.
Right. Right.
Yeah.
Yeah, absolutely. Both their toxic overwhelm and then also just their mental overwhelm of everything that they have to do all at once.
Yeah, because it's all new. It's all brand new for most people.
Right.
Do you recommend any other protocols for those struggling with acid reflux?
So for acid reflux, not a protocol per se. My first education with acid reflux, that was not the emergency department, give them antacids, was in my functional nutritional therapy practitioner training, where we talked a lot about zinc and stomach acid and replenishing those. So I don't specifically have a protocol, but it's very specific to the person. So when I work in person with somebody, I'll teach them how to actually assess, looking right on the sides and pushing on the different areas. That would be those reflex points for low zinc and low stomach acid, and actually, assessing that with them and showing them and teaching them how to feel on the areas of their body that would show a deficiency. And then working to replace zinc and stomach acid specifically to start off. I also do a lot of breath work, or I encourage a lot of breath work just for that parasympathetic aspect, especially before eating. Because I know usually when I work with someone with acid reflux, we're talking about, there's usually a parasympathetic issue that we're working on there. And then I also work pretty closely with a myofunctional therapist who does a lot of acid reflux work as well. So working to train the musculature of the mouth, the tongue, and then she does breath work as well to help with the acid reflux. So those are usually so GAPS is a great tool for this, and that's usually kind of the progression. First starting with zinc and some stomach acid, and even just teaching them little things like, all right, here's a pinwheel. Before you eat, you're going to breathe in your nose and blow the pinwheel 3 times, and then you're going to do it with everyone in your family, and you're going to blow her pinwheel, and she's going to, everyone's going to blow those, or using little tricks like that just to help them with that breathing. And even simple things like that, I find so much good results with. But then, other than the myofunctional therapist, and then GAPS, those are my go-tos.
Wow, that's really interesting. I actually didn't think about it too much, about having to rest and breathe before you eat. That would actually help with the reflux while they're eating.
Yep.
So that's really interesting.
Yeah, mostly because, it's going to help bring in the parasympathetic, so that we're stimulating some more, the gastric enzymes coming, but it's really helpful with low stomach acid. So with actually allowing your body to create more of the stomach acid just as a precursor to your meal. So yeah, that's why I like to use it ahead of time. Yeah. Plus, it kind of just goes along with, again, that traditional, let's just say a prayer before the meal, or let's thank the chef before a meal, right? Just kind of getting into this rested place, whether you're going on a pinwheel or not, just engaging with that to really start being able to appreciate your food too, because that's another aspect with it. If you're not digesting well, why you would have acid reflux. And so smelling your food and seeing your food and thanking the chef, rather than just gonna grab my food, gonna eat it and not think about it, right? So even just kind of engaging in that just slow, slow style, slow style of eating and sitting and praying and all of the things. So
you find works really well with people to help reduce the stress, which can cause acid reflux. I love that. I love it.
One more thing I would say that just popped in my head. I do often have people evaluated for a hiatal hernia too. Sometimes that is something that's really helpful as well. So I have a chiropractor I work with closely who does hiatal hernia assessment and reduction if necessary, and I find that helps too. So it's everything all together, right? It's not one thing, because even if that's the case, that and the hiatal hernia is reduced, then it can still pop out, and then then we need to continue working. So we do everything all at once. So that's another thing I like to bring in.
Yeah, it's interesting that you said that. I actually fell into, well, it's my mom. I fell into it because my mom was seeing a chiropractor, but he wasn't totally practicing. And she asked him about the hiatal hernia because I had a very large one, and he did adjust those. And so I went in and had adjustments. And it's interesting. I discovered that not many chiropractors actually can do that. So, but if people can find one, then that is really so helpful in this journey.
Yeah. Yeah, absolutely. Yeah, that's why it's just important to have your people that you know and you trust, right? And okay, so this is the person for this is the person for this. Yeah, that's great. I love that happened with you. Yeah.
Yeah, and then after 3 visits, I asked him if there was a way that I could do it myself, and there was. So he showed me how to adjust it down, and by then it didn't need the big pressure that he would do it. So
yeah,
so he showed me what
so
to do.
Yeah, good. Oh, I love that. That's so good.
Yeah, that is, it's interesting because most people don't know that the hiatal hernia can be adjusted down, that you have to go for other ways.
And it sounds terrifying. I've had so many people like, oh, does that hurt? Right? Like it sounds like it could be a terrifying kind of thing. And it's not comfortable. I personally haven't had it done, but I hear it is not comfortable. But so much better than the alternative, right? With being able to bring that down and then work on it on the back end. So
yeah, it's I wouldn't say it's painful, but it's not comfortable. It's probably in between not comfortable and painful, but it's over quick,
Sure.
and you feel such good benefit that you're happy to go again to get it done.
Yeah.
And it's not something that you have to have done all the time. Like I only had it done 3 times, and then I was able to work on it myself, which was not even close to uncomfortable.
Yeah.
So
yeah, that's great.
that's
I love
really
that.
cool.
Yeah. Yeah, we need to share that story more. I think more people need to hear that.
Yeah. I actually have a YouTube video that I use. My son shows it, but I explain how to do it once you get adjusted.
Okay, good. All right, good. Cool. I will look that
up. Okay, so my next question is on when you decided to become a GAPS practitioner, but you decided after your second baby was born to actually become that. So tell me more about, go a little bit deeper on why you decided to become a GAPS practitioner.
So, like I said, at the time I was still working in the emergency department. I was working as a nutritional therapy practitioner, and I was doing that just kind of on the side. So I had a couple patients. It was just very much word of mouth. I wasn't, I was really just growing in my experience with that. And it was very helpful. It was a really good foundation, the education that I got to become a nutritional therapy practitioner. But there were still a lot of cases that I just was kind of baffled by, or I felt like I didn't have the tools to help them. Like it just kind of, they were like the next step, right? I could help kind of the minimal base of symptoms, and then that, the next step ones. And that's where GAPS came in for me, where kind of the Candida diet helped with my basic stuff. Then GAPS really is what brought me to the more deep foundational healing. So so that was a big reason for me getting into GAPS, or a GAPS practitioner of, okay, well, what about the people that I know there's a better answer for, but I don't currently have the tools, and that gave me a lot more of the tools to be able to work, to help a lot more people who were coming to me that I felt like I didn't have, the next step.
Yeah.
So,
but you were doing GAPS at the time, but you felt like there was possibly more information on how to help people as a practitioner.
Yeah, absolutely. Right. Because you can read the book, and I actually wasn't working with a practitioner or a coach or anybody. I was doing it by myself. So you can read the yellow book or the blue book and have a good basis to go on. but there's more, right? There's
Mhm.
always more. I mean, I have so many people who come to me now, like, I read the book and I did the things, but I have so many questions, right? And so that was what I was like, all right, I need to have the answer to these questions so that I can really have good answers, or just more understanding was more of it, like a deeper understanding of how the body works. Because I was also finding that what I learned in nursing school is very different from what I was learning on the naturopathic side as I was changing my practice. So yeah, it really did help just kind of solidify how the body actually works so that I could have a better foundational knowledge.
Okay, yeah, you needed, like you said, more tools in your toolbox, so that, and more understanding of how the GAPS diet would help the people that you're working with the knowledge you already had.
Yeah, yeah, and I like that it's educational both on the protocol, but also just on good, real science, and not just hypothesizing and shooting from the hip that a lot of other medicine that I saw, that's how it was operating. So yeah.
Wow, thank you for that. That is so, it's really interesting to see how you got to where you are now. It's just the path is just, I mean, I really enjoyed hearing your details there.
Thank you.
Okay, so tell me, what exactly do you do as a GAPS practitioner?
Yeah, that's a loaded question. I'll try to keep it short. So a GAPS practitioner does a lot of things, right? So of course I help to guide people through the GAPS protocol, right? The GAPS nutritional protocol. But a lot of it really is helping to dig deep and help make connections. So helping others understand how their history, how their mom's history, how their root canal, how, all of their different things throughout their life really have a common denominator, and really that things make sense, and that their bodies are not, they haven't gone haywire. They haven't just suddenly decided to do something crazy. Like, no, this is actually, there's reasons for it. And your body is operating well with what it has to do it, or what it has, right? What it's been provided with. So a lot of it is really helping others understand what is going on in your body, so that they can then understand how we need to go about healing it. And then really understanding symptoms. So I help people understand, well, what are your symptoms saying? How do we interpret the language of the body and understand what it is saying, so that we can know how to proceed, what your body's asking for. It's a lot of encouragement, because chronic illness is so discouraging. It's frightening, it's discouraging, it's really hard. And I work with really anybody right now, but I work with a lot of families. So moms doing GAPS with their kids. And that's so hard as a mom to see, well, why is my kid so sick? I've done everything right. Or, why are they still having flares after we've done so much work, right? So just a lot of encouraging and helping them understand, again, what is going on? What is the body saying? Is this die-off? Is this some other kind of reaction, like, which is what's going on? So really, it's guiding through the protocol for sure, but then also really helping with just understanding what your body is doing, what it's saying, so that after they stop working with me, they can continue to understand what the body is doing, what the body is saying, what it is asking for, that kind of thing.
Yeah, which can be confusing. And so I like how you help people listen to their bodies and see what it's telling them. And the encouragement, we all need that encouragement.
Yeah. Absolutely.
It's not an easy thing to go through to do healing and to do it this way. So it's different. So I like that. So why would someone want to choose you as a practitioner over another?
That's a great question. So I mean, every practitioner comes with their own background, right? So their own background, their own personality, their own strengths and weaknesses, right? So I think a lot of times what I love to hone in on really is helping moms understand what's going on with their kids, helping moms with themselves, just because I came to it from this postpartum place,
Mhm.
and I've utilized it with my kids and then a lot of other kids in my practice. So that's one place that that I really love to work with, and I think I just attract those people because I love to work with them.
Yeah.
um, Also, I do have the background in medicine, so a lot of times people are just more familiar or comfortable with someone who they can say, "Hey, I have this long list of medicines," and I'm not like, "Oh my goodness, what are these?" Like, "Oh, I know these,
Yeah.
I know these
Yeah.
well. I know how they work, how they interact, that kind of thing." So that's an asset, just my background.
Mhm.
And a lot of times there's a time that I thought, well, I wish I wasn't an ER nurse. I wish I had just gone right into naturopathic health. And I've come to realize, no, that was a great foundation, a really great place to be able to help people understand where they were and now where they're going, Um, and yeah, oh, and then probably one other is just I really love to help my patients be able to function on the GAPS diet. So
Mhm.
everyone does that, but what I mean by that is, um, it can be really hard, and you can have detox and you can have stinky armpits, and your husband doesn't want to be near you because you have stinky armpits. Like, how do we deal with that, right? Like,
Yeah.
how do we in real life be able to function and to do our jobs? And I think especially a lot of the women that I work with, that's something that they don't just need someone to tell them a protocol, but more of like, okay, how did you do this as a mom, as a working mom, as a wife? Like, how did you go through this and find healing while still keeping sanity and being able to get up? And I love working with those kinds of people. Yeah.
You went through all that, and so
Yeah.
you're much excuse me, you're much better at connecting and understanding them. And
Yeah. And again, just I really consider that just the grace of God being able to say, hey, you know what? Like, you're gonna go through this, but there's a reason for it.
yeah,
So I'm
you'll
thankful
be
I
okay.
can be on the other side.
You'll be okay in the end.
Yeah,
Yeah.
absolutely.
So yeah, people are drawn to you because your specialty in families and babies, and as well as how you can take them through everyday life and survive it. So,
Yeah.
what are your biggest challenges you face as a practitioner?
Yeah. Probably just on a personal level, I would say that it is hard to be the one who's encouraging all the time, right?
Mhm.
And so when you have so many people that you are working to encourage all the time, that can be hard. And that's something that I think is really important for other practitioners, to have your people that you can have your colleagues, those that you work with, to be able to be a good support to you as well. So that for me, so I'm not going to my husband and saying, oh my goodness, well, first of all, I can't because there's HIPAA issues, right? But just kind of unloading, but being able to have people that you work with who are in a similar place, that's been really helpful for me, just with that kind of aspect. I think on the more practical level, something that, it's still a lot of people don't know about GAPS. It's still a lot of people don't know about healing through food, that it's even a possibility. I still have so many shocked eyes looking at me. What, we can do that? Like, you
Yeah.
don't have to have a steroid in order to work with eczema or something like that. So I don't know if that's necessarily a challenge. I like it. I think it's a fun challenge
Yeah.
to overcome. Like, guess what? I have a great message to share with you. But that's probably also one that there's a lot
Yeah.
of disconnect between. Well, no, I've been told that has nothing to do with diet. That's a challenge
Yeah.
to be able to explain through that. But it's a fun challenge, though.
Yeah. It sounds like you were working through those challenges, and anybody in any job and situation needs people to support them as they're supporting others. And it
Yeah.
sounds like even though that challenge is huge, you've figured that out. And that's
Yeah.
really also makes you a really good practitioner,
Mm.
because you are coming from a place of, where you need to be.
Sure. Yeah. It's very important. Yeah.